You're welcome again. This is your friend, No Solution. This is where you can always come back for your health tips. Let's talk about, can smoking affect your bladder control? Smoking is a known risk factor for several of medical conditions. However, it may cause bladder damage that you are not even aware of. In this video, you will learn that chemicals from tobacco and e-cigarette irritate the bladder lining and weaken its muscles over time. This can lead to some serious issues, including urinary infection, overactive bladder symptoms, or even bladder cancer. How is the bladder affected by smoking? That's what we're going to be talking about. The following are some ways in which chemicals in the tobacco smoking affect bladder control. Metabolite excretion related bladder irritation. Smoking inject toxins like nicotine and carcinogen. Carcinogen are sometimes that can cause cancer into your blood, which are filtered into your urine by your kidneys. These chemicals irritate the lining of the bladder, which leads to inflammation and raises the risk of urinary tract infection. Chronic irritation weakens the muscles of the bladder, which makes it hard to control urination. Smoking can have various negative effects on your health, including your bladder. So, if you are concerned about medications like sleeping pills might affect bladder function, in this video, we will be talking whether sleeping pills can cause bladder problem. Loss of bladder control, muscle control, nicotine disrupts both the central and peripheral neurological system, which compromises the neural regulation of bladder muscles. And this one may result in distrustor, that's the muscle of the bladder hyperactivity, a disorder that causes the bladder muscle to contract involuntarily, resulting in symptoms of urgency and, of course, frequency. You want to wee wee, you cannot, you can't keep your urine. There will be reduced blood supply to the bladder. There's something we call atherosclerosis caused by smoking is believed to be a factor in the development of lower urinary tract symptoms. Smoking restricts the blood flow to the pelvis and the bladder by stiffening and shrinking the arteries there. In addition to causing bladder dysfunction, this compromised blood supply can also result in unintentional urine leaks. You understand? And the carcinogen in tobacco, those things that can cause cancer in tobacco, gradually builds up in the bladder and damage itself. Smoking also causes overactive bladder syndrome. The patient feels frequent and sudden urges to urinate, accompanied by, leakages before you even get to the bathroom. Smoking also affects the lung health to a greater degree. If you have bladder irritation and weakness, you should first consult a healthcare professional about it. The effect of e-cigarette on bladder. Nicotine is a key component of most e-cigarette and it irritates the bladder. Other chemicals in e-cigarette include propylene glycol, flavoring agent, and heavy metal, which further cause the irritation of the bladder. The absorption into the bloodstreams will lead them to be excreted in the urine. This later causes irritation of the bladder walls. This irritation, I tell you, damage the urothelial lining and may increase chances of urinary tract infection, thus worsening the problem about bladder control. The symptoms of vaping are just as similar to those of smoking as they can be and include overactive bladder. So people may experience frequent urges to urinate, of course, even when the bladder is not fully distended, it's not really full. Despite the fact that vaping is often considered less dangerous than smoking, its impact on bladder health is a cause for concern. Which bladder problems are linked to which bladder problem are linked to bladder problem? These harmful chemicals from cigarette include nicotine, tar, and cancer-causing substances. These elements find their way into the blood system where they have to be filtered by kidneys and end up highly concentrated in our urine inside the bladder. So among the first substances found to be bladder carcinogen in cigarette smoke were aromatic amine such as aminobiphenylene, and all these effects make chemicals in the e-cigarette problematic for the functioning of the bladder, leading to the following outcomes. Number one, bladder irritation. Chemicals like nicotine irritate the bladder lining, causing inflammation. This irritation leads to increased urgency and frequency of urination. Weakened muscles, long-term exposure to these toxins weakens the bladder muscles, reducing the ability to hold urine effectively. Of course, there is increased risk of infection. Irritated bladder tissues are more prone to urinary tract infection, right? Which can worsen bladder health. Overactive bladder, of course, we have some symptoms. Nicotine controls the nervous system, leading to symptoms of overactive bladder, which include sudden and uncontrollable urination urges, bladder cancer, carcinogens such as aromatic and amines. Carcinogens are substances that can lead to cancer, and polycyclic aromatic hydrocarbons, which damages bladder cells, greatly elevating the risk of developing bladder cancer. Then let's talk about, can quitting smoking improve bladder control issue? Quitting smoking will improve bladder control problem to a great extent by minimizing exposure to harmful chemicals, irritating and weakening the bladder. Smoking introduces toxins like nicotine and carcinogen into your system. These substances irritate the bladder lining, causing inflammation and weaken the muscles that controls urination. So stopping smoking allows the body to rest, repair, and regain better bladder function. And you know something? Former smokers, according to a studies, are less likely to experience bladder-related problems than active smokers. So with the improvements in bladder health, quitting has reduced other smoking-related conditions such as lung and heart diseases. So at the time of quitting smoking, the bladder lining heals fast and reduces irritation and inflammation in the bladder. Eventually, through this healing process, bladder control becomes normal again. Quitting smoking also reduces the risk of developing overactive bladder symptoms, including frequent or sudden urges to urinate. So, therapy to replace nicotine, are also known as NRT, is an option for those who really want to quit. So, you should see your doctor if you're having problems in quitting. And another additional advantage of smoking cessation is a reduced likelihood of bladder cancer. Carcinogens in tobacco damage bladder cells, but stopping smoking halts further damage and does what? Promotes cellular recovery. Improve overall health from quitting also enhances bladder performance. So this smoke-free lifestyle improves not only the bladder control, but also reduces other potential health issues such as heart diseases, respiratory disorders. Bladder health is maintained better when hydration and dietary intake are appropriate, and there are consultancies with the professional who manages bladder control disorder. So see you in the next video.